10 must-know things for parents amid COVID 3.0.
Luckily, children and adolescents tend to have more mild symptoms in COVID as compared to the adults. In order to keep our children and family in good health, we would be discussing few very important things, which need to be paid very due attention to. 1. Isolation of the infected kid. Isolate kid from the rest of the family as soon as the classical COVID symptoms are observed for the first time. In particular, if there are other kids and/or elderly persons in the family. Even young people with other complications like diabetes, heart, and lungs problems need to be extremely careful. Keeping the unwell kid, isolated sounds heartbreaking. I know, but do we have a choice? If we have it, we need to reconsider our choice once again. It is necessary to protect ourselves with masks and/or shields while taking care of sick kids. Also, if in any case, adult is also tested positive, the two should ideally be isolated separately. The viral loads, amount of virus present per volume of blood/body fluids, for adults is higher than children. Children would be at the risk of getting more virus when adults breathe or cough. When it is not possible, due to room restriction or so, the adults must wear masks to protect the child. 2. Classical symptoms. By and large, the symptoms of COVID 3.0, i.e., Omicron, or the previous strains, infection in children are similar as those of adults. High fever, sore throat, tiredness, severe body aches. 3. Child sick, with COVID-like symptoms. What now? With such a high rate of transmission in third wave of COVID, consider it as COVID positive and take all precautions possible and make sure to consult with a doctor and get advice ASAP. But do not panic. Doctors would most probably recommend testing for the COVID, at the same time giving some medicines on the basis of symptoms prevailing. It is highly recommended to abide by the same. 4. Testing as soon as possible or as appropriate. Option 1. RT-PCR can be negative in early days of infections, even if kids might be positive. Even though RT-PCR, reverse transcription, polymerase chain reaction, is most reliable test, hence called gold standard test. Still, it might result occasionally into a negative report. This is usually the case if the sample is collected from an infected person within 2-4 days of onset of the classic COVID symptoms, fever and cough in many cases, though not always. RT-PCR are relatively costlier, time-taking, and need professional skills and resources, instruments and specialty reagents, hence take quite some time to be performed to generate final report. Option 2. Rapid antigen test, RAT, immediate relief. Although not the preferred choice, as it reports false positive many a times. A false positive test in one which shows a positive test, but it actually isn't. Still, the first step could possibly be the rapid antigen test, for the immediate relief for many of parents. Rapid antigen test is really fast, economical, and easy. This much that you could do it now from the safety of our home, thanks to the number of kits available online. 5. Use only paracetamol for fever. Use only paracetamol for bringing the fever down in kids. Paracetamol is the safest anti-fever medicine for children. Use the correct dosage as per advice of the doctor, which is as per the weight of the child, after the stipulated time only, which is 4-6 HRS. It is very important to cross-check the correct strength of the medicines, as some medicines are available in double strengths also, thereby the required dose would change accordingly. Usually, it takes 30-4 to 5 minutes for paracetamol to bring down the body temperature. So, no overdoses, even if fever doesn't subside. Do not panic. If that's the case, please contact your doctor. He/she might need to change the composition or the dosage. Let the doctor only take the decision after evaluating all the pros and cons. Sometimes, doctor might prescribe ibuprofen or mefenamic acid if fever doesn't come down. Do not use aspirin or Nimesulide for children. It is important to check temperature too frequently. Usually, it should be 3 to 4 times a day at a gap of 4 to 6 hours. However, if the first temperature is very high, 101 deg F or higher, it is recommended to recheck it more frequently, like once or twice an hour.
Keep a thermometer. If there are kids at home, are you still looking for one? We have handpicked it for you, in case you like it. This one is from Dr. Trust. Waterproof, flexible tip digital thermometer. The best value for money in its category of digital thermometers. This one is from Vandalay. Infrared thermometer. Non-contact. Used as forehead temperature gun. Costlier but more efficient, safer and blazing fast. Link for this product is given in the description below.
6. Basic primary healthcare. If kid is suffering from COVID-like symptoms, apart from medicines, comforting him/her might need one or more of the following. Sponging. If fever doesn't come down, lukewarm water is preferred. Even in high fever, ice-cold water not allowed. Sponge from head to toe, preferably after 15-20 minutes post-fever medicine being administered. Moving moderately fast over the whole body gives the best result, rather than holding on just one place. Rehydration. Excessive water loss due to increased body temperature might lead to risk of dehydration, which drying lips may tell you know very well in advance, before the child is actually dehydrated. Keep giving him/her lukewarm water frequently in small amounts, in case child doesn't want to drink much of it. 7. Management of chilling. Comfortable clothes be preferred, neither too loose nor too tight. Even if kid experiences chills, which might include shivering or trembling, shaking, chattering teeth, having goosebumps. These are involuntary body responses. Involuntary means you can't consciously control them. Shivering causes your muscles to contract and relax, which warms up your body. It happens with too cold weather or when body is fighting off an illness. Treating a chilling kid might need a hot beverage like chocolate. If not, a warm cloth or blanket would suffice. No excessive cloths or blankets over blankets, please, as it traps body heat and increases the temperature towards fever. 8. Give doctor prescribed anti-allergens on time. Anti-allergy medicines as prescribed by your doctor should be regularly given. Anti-allergic medicines include mostly levostirazine, montelukast, fexofenadine, and loratadine, etc. Have well-documented effectiveness in children. They help in relieving congestion, runny nose, and mucus buildup. Remember, do not treat your kids on your own or with your medicines. Follow dosage as advised by your child specialist. Diphenhydramine, Benadryl, must not be given for children below 2 years. It is reported to lead into severe complications. 9. When to be alarmed? All that being said, parents must also know it clearly when a fever may need hospitalization. If child is younger than 3 years of age or has any of the following conditions, contact your pediatrician/family doctor to seek assessment on possible hospitalization. Temperature above 104 deg F. Fever lasting for 5 continuous days. Headache, stiffness in neck, difficulty in breathing, abnormal body movements or behavior, extreme drowsiness, excessive cry or irritation. However, a child with fever, but with the following signs, should be a matter of relief for parents. Playful and active during interfebrile period. Duration between fever when temperature is -98 deg F. Eating/drinking well. Passing urine normal. 10. Good practices on safety and COVID-appropriate behavior. We have very little data available about the effects and after effects of Omicron in kids. By the time we need to keep our kids safe by adopting COVID-appropriate behavior and stay well informed. Briefing the children frequently about do's and don'ts would be necessary as they become less serious about the dangers over time. These points may be of utmost importance. Make sure children have clean hands. Wash hands appropriately with soap and water for longer enough to ensure their hands are really clean. Use an alcohol-based hand sanitizer. Excessive use must be avoided where there is less ventilation. These must be prohibited at places with open flame. Proper respiratory etiquette. Good habits must be inculcated as early as possible. Children must be trained properly for the sake of their own safety, as well as those of their near and dear ones, which could later extend to the society. Covering mouth while coughing. Sneezing into elbow. Wearing mask appropriately. With clean hands, the mask should be put on, covering their nose and mouth completely. Don't touch the outside of the masks. Virus might be sitting on there. And when mask is took off, hands need to be cleaned once again. Explain them why if needed. Thanks for watching the video. Stay well informed, stay protected. Bye. See you next time. Take care of yourselves and your loved ones too.